Welcome to Nourished with Nora. I'm so excited today to have with me Dr. Deepti Agarwal, a triple board certified integrative doctor. We get into your personal health planning, your personal board of directors, what integrative medicine is, a framework around her 5D approach to designing health into your life, some look back into how do you help your kids unlock health, and also how do you have a really strong accountability buddy to achieve your goals, and much, much more. I'm so excited for you to learn from her. She's one of my favorite people, and I learned so much in this conversation. Personal health planning is a brand new concept that you'll be hearing a lot more about. But the idea, high level, is that you actually use data and your intuition to create a plan, an annual plan, but break it down at a weekly level to design health into your life. Deepti, tell me about why you love personal health planning and more about what it is.
Yeah, so to me, personal health planning is really what I do on a daily basis, which is precision medicine, which is N of one medicine, and it's the study of you. So I like to talk about how your body narrates how you're feeling, but your numbers really tell the story. And so getting data really provides you as a person with structure. It provides you with trends on how your body's doing. It gives you the hard facts. And then you're able to track progress and also tune in and ask, how do I actually feel? And the deeper you get into this, the more self-quantified you're going to feel and the better your health span journey will be.
I love it. I've personally seen the effects of this because 2 years ago, I was all intuition and I didn't have any data. And now I've become a data nerd between labs, function, health testing. My Aura ring is probably my biggest tool. And so now I pair that intuition with the data and then with expertise, medical expertise like yourself. And that has really helped me unlock this new level of health that I'm so excited about. So I personally see the benefits of this. And it's just, I love this concept of personal health planning.
This is both of our favorite things. So first of all, just going back to that, you came in with a really good mindset. You were always super interested in taking care of yourself anyway. And as we both know, movement's medicine. It's not just about fitness. It's about healthy longevity and quality of life. And so one of those things that we looked at was you had a whole body MRI done. We looked at the scan carefully. And I thought for you, who's, you like to stay active anyway, but certain things that can really help move the needle for you, we're doing a combination of Pilates and strength training, right? And Pilates, the two of them is a secret weapon, but I really think Pilates is a secret weapon because it strengthens deep core muscles, right? That protect the entire spine. And those core muscles, we always think of them in our abdomen, our belly, but we have them deep down in our pelvic floor. We have them line our entire spine and even our neck. And so that's why I think given your situation and the fact that you had just finished having your babies and we're trying to get back in shape was like the ultimate thing for you to get into. And then to layer on top of that, strength training, because that helps people just who have desk jobs and who stand for long hours, and it prevents injuries in the future. So those were, I know, two things that we talked about. And doing exercise. And even exercise snacks. Like that was something that we always love to do when we're together.
We talk about that a lot. I love the concept of exercise snacks, especially because I used to be like an ultra runner or rock climber, and pre-babies, I would go for like kind of longer, harder workouts. And I had to change kind of my mental approach to working out and to doing those, 5-minute deep squats or exercises or planks or just getting out and every 45 minutes trying to move a little bit. And then you also inspired me to get a walking treadmill. So now I have a walking treadmill and a bunch of my colleagues have walking treadmills. So we have treadmill meetings. Yesterday I was able to hit 20,000 steps, which is bananas. I had a walking meeting that I scheduled on a hill. And then I took 2 1-hour meetings, which were long meetings, but they were like all nonprofit meetings from my walking tread. So between like the Pilates and then just snacks and then incorporating movement when I was stationary, it had to be at my computer, has been really, really powerful. I could do more. There's still more I could do. I'm like a self-improvement junkie. So I definitely am like, when you talk about weightlifting, I'm like, I probably haven't met our goals for that quite yet. But thank you. That was like a really helpful overview, I think, of personal health planning. And then you actually worked with me and we talked a lot about like, how do I schedule it on my calendar? So now I have an open calendar and I put Pilates, like this morning I had Pilates at 6:30 in the morning. It's on my calendar. I have, breaks or deep squat or breathing breaks. And so you really helped me think through like, how do I make this ongoing and a commitment and actually plan my health? Like we plan so much in our lives, and we plan our work calendars and we don't plan our health. So personal health planning is about actually calendaring and creating a strategic plan to move, to go to sleep early. I put my early bedtime sometimes on my calendar. I put dinner with the family early on my calendar.
That's important, right? What you're saying right there, just for a pause for people to listen to, your like sustainability is going to beat perfection any day, right? And so the best health plan is one you can maintain in the long run. And so the fact that you're just starting somewhere and it's on your calendar, it keeps you consistent. And I'm sure you can tell people that your Pilates game has changed over the last year, right? It's so much more consistent. I'm sure you feel the improvements just from doing it, right?
Absolutely.
Yeah. It's so important that you plan it. I think that's key.
And I think it's like, how do we schedule it and prioritize it, and by like writing it down and putting it somewhere. And then I think the other piece of it is like having an accountability buddy. And thankfully I get to have you as a doctor and as a friend as an accountability buddy. But you check in on me. We trade Aura Ring scores. We're in a little bit of a sleep competition and who can have a higher HRV score, which is the nervous system calming at night. So talk to me a little bit about the importance of accountability buddies and wing people when it comes to your personal health planning.
Yeah, so I think having an accountability buddy is important in general because we all need accountability buddies for different things in our lives, right?
Yep.
And so I think even you and me are a good example of different types of accountability buddies, right? But what does that do for each of us? I think, first of all, as you mentioned, having a weekly or monthly check-in, super powerful, right? That's just where the consistency comes in. And then a good accountability buddy also challenges you, but also offers grace when you need it, right? So it's like that balance that we offer each other, like a little bit of push versus support. And then we track progress together, right? So we remember each other's goals, keep each other accountable. We celebrate our wins together. We talk through things that we can improve. And to that point, we also can call each other out, with love. There's no sugarcoating, just honest feedback. And I know for someone like me, I ask for advice when I want to hear what someone has to say. It's just, some people aren't comfortable with that, but that's, I think, a really important part of the relationship.
Yeah, asking for feedback on your personal health with your accountability buddy, like, really asking them for that accountability and talking about it, I think is okay. And you've been an amazing accountability buddy, so thank you. And I'm excited for this next chapter. We have some exciting travel, and we're hosting a big longevity panel that's not public yet. But on that trip, hopefully we think about when we travel too, how do we do these events or have these work moments, but then also schedule in wellness. So we've been good about holding each other accountable, even when we're out in the world and work and life is extra busy. So having
that's why I love traveling with you, because I always know we're going to be able to keep a semblance of our normal life in our travel life.
Yeah. Healthy food, movement. We're like prioritizing sleep whenever possible, but also enjoying life and living in the moment and whatnot. So amazing. What would you say are 5 game-changing habits that you help people shift when you think about going for what really matters, and how do you prioritize? We can't do it all. And it's exhausting when you think about all the you see those memes that are like, did you get enough sunlight? Did you walk enough? Did you sleep? You have to, like, it gets overwhelming. So when you break it down for people and help them focus on the most important things that will move the needle and have goals in movement and food and sleep, etc., what are 5 majors that you really help people focus on?
Yeah, so I think, like you said, there's always the standard, like try to walk after a meal and meditate and, have protein with breakfast and all those things. But I've actually thought a lot about this because I've had to incorporate that into my own life, right? Like just kind of like a personal and professional. And then this bleeds into when I'm working with our patients or clients. And I like to call them the 5 Ds, D for my first name. So I always think to myself, okay, so one of them is decide once, or batching decisions, right? So minimizing small decisions so that you can focus on bigger priorities. Because at the end of the day, the one thing that I think we can truly say is fair in life is we all have 24 hours, right? So how are we going to spend those? And that's really what helps you decide how your days are going to be and how your habits are going to show up and be for the rest of your life. So that's one thing. The other thing that goes along with this, and these are, like I said, both personal, professional, and health goals, is designing your life. So just being intentional. You want to align your actions with your values and your goals. And more simply, just how are you spending your time? How are you being intentional about the people you care about? In general, like you can really get a lot out of being intentional with that. The next thing is
I just want to make sure I'm tracking. So first decide, like commit to it and be like, I have 24 hours. I have one precious life to live, and I want to prioritize being healthy like daily. And then 2 is design your life, and actually then if you're committed and you've decided, then design intentionally and make a plan to do those things. Am I tracking correctly?
Yeah. And when I say like the decide once, kind of like this batching of your decisions, every day, if you have to think about basic things like, okay, what am I going to eat for all 3 meals? Or like, how am I going to dress? Like, if those things can somehow be capsulized in your life, it actually makes your life a lot easier so you can focus on bigger picture things and you don't feel so bogged down. Because what I find with a lot of patients is some of these things actually create a lot of stress for them, right? And so it's like, how do you create time and space in your life to do these things? And then the next thing with designing your life.
Just really quickly, I know you do that with meal prep, and we've started to do that where you like decide on a Sunday what you're going to cook for the week, have those hard-boiled eggs and that fiber and those veggies like pre-cut and ready so that you already know kind of these are my core elements that will nourish me this week.
Yeah, so that's, I would say, more like design your life. And then one of my other D's is like a dashboard Sunday, right? Where it's a Sunday planning ritual, even like 10 or 15 minutes just to set up your week. It's less chaos. And that includes so many things, including what you just said, right? It's just like, what days, what does my work week look like? What's my family life going to look like? How am I going to fit in my workouts, meetings? How am I going to prioritize what I'm eating? I think we always say in our practice, failing to plan is planning to fail. And we really mean that, because none of this stuff is just, it takes work, right? It's not a walk in the park. And once you make it part of your daily routine, it actually doesn't become that challenging. It just becomes habitual for you.
Yeah.
So the dashboard Sundays was another thing. Obviously, daily movement. So your body breaks, right? The stuff that we talked about, the movement and breath work reset, and just even taking a few snippets of 5 minutes during the day, a few times a day, can really add up. And think about those 5 or 10 minutes every day times 30 days, right? That's already 150 minutes that you've created for that, those body breaks.
Yeah.
And then the last D of my 5 Ds is just deep work, just really trying to create a distraction-free zone for your own productivity. And that's probably not as much of that I talk to patients about, because a lot of our patients coming in are pretty high functioning. It's just that they've got to get the rest of the plan down because they're so busy and productive at work. But those are sort of my game-changing life hacks.
I love it. Can you repeat them for me? I was writing them down. I haven't heard of this framework and I love it. So can you just repeat them for us?
Yeah. So decide once, like batching your decisions, design your life so you can be intentional, daily movement, dashboard Sundays, and deep work.
I love it. Okay, I want to pivot a little bit and talk about real food instead of medicine. And we talked a little bit about food, but you and I really bonded over real food as medicine. I know you have a personal passion for it. You're an amazing cook. And you can share more about your background and whatnot and your draw to it. But you're one of Eat Real, one of the leading health nonprofits where I'm the CEO. You're one of our incredible advisory board members, and we're launching a new medical advisory board, and you're one of the first people to raise your hand for it. So can you talk about why you're passionate not only for real food for people like me and people our age and older people, but especially for younger people? Can you talk about why you care about real food as medicine for kids?
Yeah, absolutely. So I think first and foremost, I hope most of us understand that food is really foundational, right? It shapes everything from our cognitive brain health to disease prevention. And kids' palates are really shaped early. And that's something that I've come to appreciate, even just thinking about my own habits. The way we get to really influence people is starting it when people are children, right? So if we introduce real nutrient-dense foods when children are young, that is actually the setup for building lifelong healthy habits. And this is where we talk about prevention over prescription, right? So if we can start solving some of this chronic disease crisis through food, why wouldn't we? Right? It just seems so simple. And yet, as you and I have talked about, it's so complicated. There's so many nuances that go into this epidemic.
Yeah. I love that, helping kids develop healthy habits early, and stopping disease before it starts. And I think, it's hard to change your habits later in life. So if it could just be part of your being early on, I think about, wow, now I'm changing so many habits. If I had just started with these habits, how my health trajectory would be even better, right? And I think about that a lot.
Well, and also I think even just thinking about culturally how we view food, how our food pyramid's designed, right? There's so many nuances that kids are they're like messaged from a young age that I think if that messaging starts to change, children are so plastic. Their brains are so plastic. They're so impressionable. And I think with people like you, the future is bright because kids will really lean into all the changes.
Yeah, especially as we change the food culture and the food system and make the easy choice the healthy choice. I think, and really shift things and make real food cool and show people how life-changing it is early on. It's so fun. And I think real food can be delicious and fun, and it doesn't have to be a compromise. So this is a really good kind of segue into real food is one of the principles of integrative medicine. And integrative medicine is a fairly newer field. And I was with you right after you got triple board certified in it. So could you share a little bit about what it is and why you got involved in it?
Oh, absolutely. This is one of my favorite topics. So integrative medicine simply just looks at the whole person, right? It's not just looking at your symptoms and treating them, but it's really looking at root causes and considering how the mind and the body are working together. So when I treat patients, right, I blend my conventional medicine wisdom, which I'm so thankful to have trained with the best and the brightest here in the US, and blend it with all the other training I've done, whether it's background in functional medicine, whether it's looking at other holistic practices, whether it's thinking through hormones, whether it's thinking through obesity medicine. Like there's a whole different way to do medicine than we're taught to do in the hospital. And I think this is really where the future's at. And I'm really excited. And I love helping people from an integrative approach.
And you have a private practice that you've kind of pivoted. What made you make that pivot, and kind of what that's like people are thinking about, oh, I would love to have that in my world. Explain more about how that works, because like more traditional insurance and whatnot, it's not available. So I'm just curious.
So that's actually a really good question. I trained traditionally as an anesthesiologist and interventional pain management physician. And what really led me down the path I am in now is, especially working in the chronic pain field, I had people coming in and I was tasked to have them leave my office with some sort of injection on board, whatever that was, right? I'm looking for a place to inject.
Yeah.
And I felt like I wasn't doing justice for so many patients. And so that's what led me down this whole pathway to figure out what other tools are in my toolbox to help people. And looking back on it now, I just feel like there were so many things that could have been done for so many of my patients. And there's still truly so many things that are missed when people are going through a traditional healthcare system.
What are some tools that people can have? They can reach out to a private practice like yours. There's more and more kind of health tech tools where you can, from home or, coordinate trying to understand your health baseline and understand your health data. So what are some of the tools that people can tap into?
Yeah. So tools, on outside of a physician's office, there's different wearables, biometrics, AI-driven insights that people can use. They can get their labs drawn. But really, I think when you come in and work with a physician that has backgrounds like I do and a lot of my colleagues do, you really can access your personalized health data in a different way, right? And it's a therapeutic opportunity that allows someone to make more informed choices about what they're doing. So you can put all your data together.
Mm-hmm.
And so I think and a lot of people come in when they're struggling with just symptoms that are very, they're not straightforward. Like I'm having fatigue, I'm having brain fog, I'm having muscle cramps. And that's a lot of what happens in a chronic pain practice, is that people are having quote unquote pain, but they're having a myriad of other symptoms. And that's where I felt like we just can't do justice the way we're trained in a traditional system.
I do think it's exciting, this moment of health. I talk a lot about how we know what apps need to be downloaded. We know what lights are in our cars, and there's a little bit of low pressure in one tire, or that needs to get changed in the car. But we don't always know what's going on in our own bodies. And there's all of this new technology. And it's one of the most exciting areas of technology, I think, that we can use, and new thought leadership and new approaches to medicine, like integrative medicine, where there are these new tools out there that we can use to really understand what's going on in our bodies, understand why we're feeling fatigue, but it's not just that didn't get a great night of sleep last night. There's probably some other factors that has to do with what kind of stacked up to that poor night of sleep. I just think it's such an exciting moment where we can know more about what's going on in our bodies, like the work that you and I had done together, pairing some of these data insights and then looking at it holistically. It feels like I went on kind of a Miss Frizzle ride, like a magic school bus ride through my body, and I know the state of it. And that knowledge then has allowed me to prioritize what's most important to get my health to a place where I can be strong for my family and for my ambitious goals for the nonprofit and whatnot. So I just feel like it's such an exciting moment in history.
And I think what you're saying is so powerful for people to hear, because there's so much out there. And I think it can be also really confusing with all the wearables and all the social media noise. And then there's all these podcasts.
Buy this thing, try this, all these supplements. It's overwhelming.
It's overwhelming. So that's why I do think it's important that people pair up with someone that they trust, so that they become more self-quantified. They understand themselves. And as you're saying right now, data.
I'm not a triple board certified integrative doctor. So then to be like, this is what I'm thinking, and this is what I think the data says, but like, and so to have an expert that you can go to then partner with you've been life-changing for me.
You mentioned this, and I just wanted to drive this point home, is that data is powerful, right? But it's not always the entire story, because you're the best expert on your own body. So I always like to tell people, the numbers tell a story. Your body's actually the narrator, right? And so that's what brings people in the door. But then I do think that having that data is really important, because it provides structure. You're able to look at trends. And actually, that's what serves as the hard facts. And then we can use your intuition to fill in the gaps. And that's really how you become self-quantified, is you track, hack, and repeat.
I love it. Track, hack, and repeat. I love it. It's been so powerful to model this to my family, of like, my little guy saying, "Oh, we're going to Pilates." And I said, "Yeah, Mom, it has to be strong. I can lift you up and I can play and we can go to Yosemite and go explore in the mountains." And then, they're doing squats too, or they're showing how they're strong. So it's been really fun, not just for my own health, but for our family's health, and making these health shifts. And so that's been really special. Yeah. So if you were to take in all this new knowledge that you have, this new approach, and go back to when you were 10, what are some of the 10-year-old tips that you'd give her or kind of whisper to her to encourage her in a positive health journey?
Yeah, good question. So definitely, I think those 5 Ds still stand. Those are things that I would absolutely have told myself a long time ago. Some of the other big things I would say, and these are things that now I can go back and say really comfortably, is trust your instincts. Like, the world's always going to try to sway you, but stay true to what feels right. And that's really why I'm where I'm at, and why I'm practicing medicine the way I really want to practice it. But it took me a minute to just realize that this is the way I really want to practice. And you don't have to do it all at once, right? So small steps lead to bigger changes. And I'm seeing that now. And I think this is a really, really exciting time in the history of our health journey in the US. So I'm really excited to see what the future has in store. Another thing I will say is that rest is productive, right? You don't have to grind 24/7.
Remind me of this, because
where we want to be. And I think we all need that reminder. But I think we probably have all found that our rest is life-changing over the last few years. And the other thing, which I think I've always thought, but I can't reinforce it more and more now, is that some of the best investments you'll ever make is actually in your health and in relationships. And I think those are the things that you'll look back on and never regret.
Well, you're so focused on both the health and helping other people unlock their health, and then also on being an excellent friend. Like you're that friend who sends the card, who calls, who texts, who leaves the voice note, who follows up, who checks in. Like you are just incredible, and you're known by your other friends. Everyone's talking about what a good friend, what an exceptional friend you are. And so it's been clear that you prioritize that. And I do think we don't always talk about connection enough and how important it is. Like our sisterhood has been really an anchor for me. And I think as an accountability buddy, but also as, the partner, the friend that will rest and the friend that encourages rest and tells me like, yeah, take time to celebrate and celebrates with me and all of that. So I think in terms of connection, could you share some of your approaches to building strong relationships? Because you are exceptional at building strong relationships.
You're kind, Nora. No, I think let's start. So how do you create a strong ride or die support system? So I think vulnerability matters. So strong bonds are going to form when you allow yourself to be seen and you allow others to be seen. So that I think is really important. And just, again, being intentional about who you want around you and why you want them around you, right? That's really important. And then one thing that I also think is so easy to do, but I don't know that we all understand that, is that always give more than you take, right? Like show up, check in, and you have to support other people in their growth, just like you want to be supported. And then another thing that you really taught me is just like checking energy constantly, right? Paying attention to how people make you feel and choose people that you want to be around, choose people that energize you, that challenge you, and just people that raise your vibration.
I love it. It's like, who makes you become more alive? Who do you help become more alive? And how do you be around those friends that bring out your vibrancy and your joy and help you unlock your goals, whether that's health or, all on all levels. So I love that you are an ultimate wing woman and partner. So I love that. And I do think thinking about who's around you, I want to talk about that a little bit, how to be really intentional, right? About who you're closest to. I think you and I talk about how to be really strategic about those people that you're spending the most time with, because that influences so much of your life. I know you have an approach about building your personal board of directors. So could you just talk about that a little bit?
Yeah. So I love this term, having a personal board of directors. And for me, what does that mean? So I like to practice medicine in a, precision medicine, looking at the whole person, right? So in more of a holistic way. And I like to think about my personal board of directors as being holistic. So I want to have diverse perspectives on it. I like having mentors / friends from all different walks of life, people who are tried and true and just my old friends that I'm just comfortable with. They know me really well.
Right.
And
of us.
Yes. But beyond that, people that have different facets that I really appreciate that also make me who I am. So that might be someone who, pushes me to think bigger, right? So like someone that's more of a visionary, someone that helps me strategize and execute, because sometimes I need that person, or someone who's like a truth teller and calls me out, holds me accountable. And then other people who just are supportive and that you feel good about, you can bounce ideas off of. I have a few colleagues that really share the same passion as me, and I consider them mentors, and I 100% consider them my personal board of directors, or on my personal board of directors, probably without them knowing. But I think that's really an interesting.
You don't officially ask them.
What'd you say?
You don't have to officially ask them to be on the board. You could just, it's more, do you visualize it? Do you write it? Have you written it down? I visualize mine. I've never written it down, but have you written yours down, or do you just visualize kind of like your inner circle, and like you kind of know the role and who you go to for what and how you support them too?
It's more of an, like right now, because I just love that term so much, it's more of an intuitive thing. I know who's sitting at the table.
Yeah.
But I do think it's interesting.
You're like, you can see who's in each seat.
Yes, I can see my table and I can see who's there and why we're all coming together. But I do think it's a powerful thing though to visualize and just this is all about being intentional, right? And really creating what you want. And you can have what you want. You just have to be very intentional about it.
I love it. Decide and then design your life and design your board of directors. Well, I love the new framework. I learn from you every single time that we are in conversation. Thank you so much for taking time. I know you're between patients and about to fly to an event. And so I just really appreciate you taking the time to share and continue to teach me and share your incredible knowledge and passion. And thank you for your leadership in this world and your friendship. And Just so grateful for you.
Anything for you, Nora? And I am so excited to see where Eat Real goes this year. I think recent changes this week are going to make things very exciting for everyone.